So I'm here with Nancy Vorhees, Chief Operating Officer at Inland Northwest Health Services, based in Spokane. Could you tell me a little bit about what you do?
Okay, so INHS is what we call Inland Northwest Health Services, and the part of the job that I'm involved most with is telemedicine. And so we have a large telemedicine network. We have about 65 sites with about 100 endpoints located across all of Eastern Washington. So we are what I call like a service provider, because we don't have any physicians in the telemedicine department that work for us. So we go out to all of our sites and we work with them to help them develop their programs. So if someone wants to do a telestroke program, we have the technology and the tools to help them develop that program, working with their physicians and their staff to make that happen. So some of the examples that we've done that are pretty successful, when we work with diabetes patients. So prior to, maybe about 3 years ago, we used to do all of our telemedicine diabetes patients over telemedicine. And then there were some changes in reimbursement, things like that. So we had to kind of stop that. Now we're going back to having staff go out, but we've been working to get reimbursement changed. Then we'll go back to doing, over the video conferencing. But we do offer that to our clients. Some other areas that, with regard to telemedicine, we've done that are incredibly successful. We have an EMS Live at Night. And so this is emergency services providers once a month get together for a class. And it's live video conferencing. We connect about 8 bridges across 5 states. We've had upwards of anywhere from 100 to 300 people that have this conversation about any kind of education. So our network for telemedicine, we do a lot of education over that. It's probably 20,000 hours of education last year.
5 states.
5 states.
This is all the Pacific Northwest.
Pacific Northwest. So we do Montana, Alaska, Idaho, Oregon, and Washington. And we've had states coming in and asking if they could do that, participate as well.
Nice. What are the specific challenges to a telehealth program in this part of the country?
Our biggest problem right now, Eric, really is the reimbursement issue. Washington State is one of those states that's not, we don't have a licensure about reimbursement. So we've been working on that. We really feel that. I think the other area, people are a little nervous about really getting involved in the program initially. I think there's some hesitancy on the part of healthcare providers. Will this work? How will my patients like it? And so I think once we get over those humps, I really think that it will grow, particularly with the Affordable Care Act, and there's so much prevention in that. And doing preventive healthcare over telemedicine is fabulous.
That's all part of patient engagement too, which is part of stage 2 of meaningful use. How do you convince a hesitant provider, say an independent physician or a small practice, that a telehealth program is something they should invest in or should be interested in trying out?
Well, part of it, from my perspective, is the location of where you are. So if you're in a rural community, and a lot of those are single practitioners or they work with the hospital. So there's an opportunity to bring specialists to work with you, to see your patients. And I think that would be great because you would be enhancing the care that your patient is receiving. So cost is an issue. So one of the things that we do when we work with healthcare providers is there's always grant funding. The federal government always has some type of grant funding for equipment, not for the program, but for the equipment. So we'll often work with the providers to obtain that grant funding and help them develop their programs. And another avenue that we have, I mentioned I'm chairman of the board for the Northwest Regional Telehealth Resource Center, and that's a great resource for the people that are just wanting to get into telemedicine. So the Telehealth Resource Center uses the resources of all the board members. So like my staff are a resource. And so if people are really looking for telemedicine, like a practitioner that's just wanting to get started, say they're in Montana or Utah or something, we have resources in all of those states that would help those people develop those programs for telemedicine.
What types of telemedicine and telehealth services are you seeing being used?
A couple that are fairly large right now, and we're seeing more growth in those. One is telestroke. So that's a very popular telemedicine program right now. We're seeing wound care because that's easy to do in terms of diagnosis and following treatment protocols over that. Mental health, while not in Washington State, in other states is really growing. You're seeing a lot of that. Across the country, you're seeing home health become very popular, primarily to keep people out of the hospitals and to make certain that they're getting the kind of care that they need to get so they don't get readmitted to the hospital. Telecardiology is becoming more popular. There's a lot of pediatric care going on in the large pediatric hospitals, particularly on the East Coast. We're seeing a lot of that. And as one of our speakers mentioned today, there is a lot of telemedicine that's working with the foreign communities.
Do you deal with a foreign provider? Do you cross the border into Canada at all?
You know, we have not done that. I know that there are programs in Washington that probably have done that, particularly, I would say, more Montana than Washington, but we've not done that. I would suspect in Seattle, being so close to the Pacific Rim, I would guess that there are probably relationships that have been established with the hospital and the telemedicine programs over here.
And finally, how do you deal with patient acceptance of a telehealth program? Is it a challenge to get them to be interested in something like this? Are they more receptive to it, and what are the benefits that they're going to see?
No, I think from the patient perspective is they're okay with it. And I think the reason that they're okay with this is because they don't have to travel. When my mother was alive, she was a diabetic. And so we lived in rural eastern Montana. She could drive 13 miles to connect with her healthcare provider that helped her with diabetes rather than 225. So I think patients are receptive. It's new. I've had conversations with psychiatrists in terms of when they were doing like working with children with behavior problems and things like that. And the children just thought that it was like a TV. And you could see a lot more from the psychiatrist's perspective when you were observing the child as opposed to being in the room with them. So I think it's just a matter of time. It's probably the older person that might be less receptive. But if you look at the statistics, it's that older age bracket that's really high on adopting the new kinds of technologies. So I would say there's probably an opportunity for high acceptance really with those patients.
What are we going to see in telehealth in the next 5 years?
Wow. Boy, 5 years. 5 years ago, if you'd asked me that, I said, well, we're not going to be using our iPads and our, with Jabber or any of those kinds of technology, whatever we use nowadays. But, my guess is we will see a lot of telemedicine being used. I think in the rural setting, I think the kinds of hospitals that we have in the rural setting will change. So I think we'll have a lot of connectivity in terms of specialist care that will be available to those patients out in those rural areas. I think we'll probably all be using our iPhones or whatever kind of technology droids that we have. I think we'll use that. I don't think we'll see any of the giant systems anymore. I think that we'll really break down the barriers, and I think that everything that we will do, we'll have the ability to do it over video conferencing, telemedicine as well.
Great. Nancy, thank you very much.
Perfect. Thank you, Eric.